affairs here at South Georgia Medical Center. And I wanted to thank everybody for taking time out of their busy schedules to come and listen to our press conference that we have. We have some very exciting news, and we just wanted to thank everybody for taking time out to hear about it. Before we get started, I wanted to recognize some special guests that we have here in the audience tonight. First, I wanted to recognize William Underwood, who's the president of Mercer, as well as his staff. If you would raise your hands, please. Thank you very much for traveling down. We have Mr. Ronald, who's our chief executive officer and the executive team for South Georgia Medical Center. As well, we have Mr. Sam Allen, who is our hospital board chairman, and some of our hospital authority board members here in the audience. If you would raise your hands, please. Thank you for everything that you do on a voluntary basis here at South Georgia Medical Center. We also have Dr. Sid Staten, who is our chief of staff, and a number of our medical staff here as well. If you would all raise your hands. Thank you for serving our patients here at South Georgia Medical Center. And then we also have some community guests. We have Valdosta City Mayor Scott Jennings Matheson here. If you would raise your hands, please. I think I'm not sure if I saw that, Mr. Bill Slaughter, who is our county chairman, and his staff. Andrea Schreiber and the Valdosta Industrial Authority staff. And then Lee McArthur, who is the chairman of our Valdosta Chamber of Commerce. We thank you all for taking time out to come here. We wanted to recognize you because it's a true partnership. Today, we are really announcing a true partnership and a true next level for South Georgia Medical Center. And it's been a true collaboration between our hospital board, our medical staff, our administration, and Mercer University. And so without further ado, I'm going to bring up Dr. Brian Dawson, who is our chief medical officer, and he's going to tell you a little bit about the new endeavor we have at Mercer University.
55% of those residents who train in the state of Georgia go on to continue to practice medicine in the state of Georgia. And for those physicians that are primary care physicians, we know that those numbers come out to be about 60% or more. And in many cases, they continue to practice within 100 miles of the place where they completed their residency training. South Georgia Medical Center is evolving into a destination area for healthcare services that cannot be responsibly provided elsewhere. And as such, we need a supply of physicians that can supply those needs in our community as we continue to evolve into this role. Our strategy for achieving this was to develop a graduate medical education program specifically to train residents in internal medicine and in emergency medicine. We intend to begin our internal medicine residency training program. The inaugural class will be in 2022, with the emergency medicine program to follow shortly thereafter. We realized in trying to develop this type of program that we needed to have a partner that was strong, that had a good reputation, certainly throughout the state of Georgia, the region, and even throughout the nation. We looked through various people that we can partner with. These organizations, we wanted to make sure that we found an organization that had three key things in common, that we wanted them to have a strong clinical background, research, and education. Thankfully for us, we didn't have to look far. After we reviewed several people and several different organizations, we found that our strongest ally was right up the road from us in I-75 with Mercer University School of Medicine. Mercer University School of Medicine has a mission to educate physicians and healthcare providers that will go on to provide healthcare to medically underserved areas throughout Georgia, benefiting all Georgians. Moving forward, we see this as an investment in the healthcare capabilities of our organization, as an investment in healthcare capabilities beyond Valdosta, Lowndes County, and even our region, but potentially even throughout the state, as some of our graduates will continue to practice elsewhere in the state. One of my first duties in this role of the division, the designated institutional officer and the chief medical officer, was to identify a program director for the upcoming internal medicine program. We had several applicants, all of whom were extremely well qualified. Any one of whom could have easily ran this program without question. We wanted to make sure we had somebody that had clinical acumen and the technical expertise, but also that tactical expertise to be able to communicate and foster relationships with these residents as they train them to move forward. We found somebody who's here with us today. This person has a long-standing relationship with our hospital organization, who is very dedicated and committed to the well-being of this community. He's practiced for nearly 30 years. He's well respected within this organization for his clinical acumen and his bedside manner. He has been particularly helpful during this more recent pandemic we've had. And with no further delay, I'd like to announce and bring out for you our new program director for the internal medicine program, Dr. Gregory Beal. Finally, I want to introduce to you our next speaker, who is a native of this particular community. He was born and raised here. He went to school here. In fact, he went to Valdosta State University, graduated in 1999. He went on to Mercer University School of Medicine and graduated in 2003. He completed his internal medicine training in 2006, cardiology training in 2009, and his cardiology interdistrict fellowship in 2010. And at that point, he came back to his community, and he served here as an interdistrict cardiologist since 2010. This individual has been singled out and specifically elected and appointed by other members of the medical staff to represent them, not only in the hospital, but in the community as a whole, as the chief of staff. And with no further delay, I'm going to introduce our next speaker, Dr. Sid Staten.
Thank you, Dr. Dawson. I'd like to thank everyone for showing up today for this wonderful moment and announcement. First and foremost, I just want to let everyone know that the medical staff has unanimously gotten behind this residency program in partnership with Mercer. Medical staff is extremely excited about it. They're going to be directly and indirectly involved in this residency program. When I graduated from Mercer in 2003, one of the things that they instilled in me was that as a physician, you become a lifelong learner. And that doesn't stop when you finish medical school, residency, fellowship, or start your practice. It continues, and it is truly lifelong. I'm very excited to continue my learning, my lifelong learning with this affiliation and partnership with Mercer. Mercer is a great university, great medical school. Their mission is to make sure that we have physicians for rural and underserved Georgia. And that's what we're going to continue to do here as we start this internal medicine residency program here, and then further on with the emergency medicine program, and a lot more great things in the future. I want to thank President Underwood, Dr. Sumner for being here. I want to thank Dr. Beal for taking on this huge task of being the program director. A lot of other people have been working extremely hard. Dr. Dawson, also Dr. Marcy Hutchinson has been instrumental in making sure that we had everything in place to make this happen. Mr. Ronnie Dean has been a great blessing to this community coming on as CEO. A lot of great things going on here at South Georgia Medical Center and the affiliated campuses and stuff. More things to come. We're going to be providing things now and in the future that before you could not get in South Georgia. You have to go to large academic institutions, Emory, Shands, Mayo. Well, those services are being provided here, and we're going to continue to expand those. We're going to continue to expand education with this residency program. I want to thank everyone that's involved and that will be involved. Thank you.
Thank you, Dr. Staten and Dr. Nelson, for your words here today. Next up, we're going to bring up President Underwood, who is the president of Mercer University. And if anybody knows, presidents of any organizations are extremely busy, so we want to definitely thank you for taking the time out of your busy schedule to come and share a message with us this morning.
We're excited to be here. We're excited about this relationship. We're excited about this partnership. We're excited to be partnering with a high-quality medical center, which this is. A medical center that has the facilities and physician staff required to operate a first-class residency program, and that's what everyone intends this to be. We're excited because of the impact that we think this residency program will have, not just on the medical center, but on this entire region. with a focus on internal medicine and emergency medicine. This will create a supply of primary care physicians for the future healthcare of this entire region, and we think that's a great thing. That's something that's needed everywhere in Georgia, and this region is no exception to that. We're excited because of what this does for our mission. Our mission is to prepare primary care physicians for rural and medically underserved areas of our state. We're very proud of that mission. We think it's an important mission, and we've had a lot of success with that mission. More than 60% of our medical school graduates stay here in Georgia, and we know if we can get them to complete their residency here in Georgia, that percentage goes up above 90%. So we're very hopeful that the residency slots here in Valdosta will be attractive to graduates of our medical school, and we can keep them right here in this region. I know that you all are hoping that we can accomplish that together as well. So I want to congratulate you. This is a big step for the medical center. It's required a lot of careful planning, a lot of thought and consideration, and you all are doing this right. So congratulations. Thank you. Really, the only thing I was supposed to do was introduce Dean of the Medical School, Gene Sumner. Gene is one of the best medical school deans in the country. She knows rural medicine. She knows primary care, not by reading about it in the book, but by living her life as a testament to and commitment to primary care in rural regions. And I'm so proud to have her as the dean of the Mercer University School of Medicine. Gene.
This is really an exciting day for me personally, because it is such a good medical center and such a great opportunity for our students. It's an exciting day. I hope for South Georgia we want to be the best partner we could ever have. I'm excited because we have so many graduates here and your medical staff, and we're very pleased with that. Somebody told me we had 100 Mercer graduates in 60 miles of Valdosta. We want to make that 1,000. So I'll tell you that I had some friends that moved down here 10 years ago, 15 years ago. I'm sure the ones that have been gone. And I was practicing, and people would say, "Where would you go, Dr. Sumner?" And I'd say, "Well, I'd go to Valdosta." And they'd go to Valdosta? Yeah, I'd go to Valdosta. Because those guys will take care of you. And every physician, not just the cardiovascular surgeons, every physician they came to cover, I have cared for them. They remembered that, and they continue to return. So I know what a great institution this is. I know how fortunate Valdosta and Lowndes County and the region is to have this great system. We want to help y'all. The good thing for us is our students will see wonderful physicians who care about patients and nursing staff and everything else, that care about people, have a relationship with them, and are community responsive in a more rural area. So they can see what a difference they can make in a town like Valdosta or a region like Valdosta. So we're honored to be your partner. We commit to being whatever we can do to help Mercer's and that one thing that I do want to point out is one reason we're able to hit that 90% is Mercer only accepts Georgians. We do that because we take our mission so seriously. We want those young people to stay in the state and serve rural and unserved populations. We look forward to being your partners and any assistance we can. We'll see you a lot in the future. Thank you for giving us this opportunity.
Thank you, President Underwood and Dean Sumner. We definitely appreciate the efforts and collaboration that will happen between the two institutions. Without further ado, I wanted to introduce our CEO, Mr. Ronnie Dean. Mr. Dean has been here for about 8 months, but it seems like he's been here for a longer time with everything that's been accomplished and all the excitement and energy that he has brought to the table. So the organization follows its leaders, and we have an excellent leader here, so I wanted to introduce our CEO, Mr. Ronnie Dean.
Thank you, you, Johnny, and thank all of you for wearing your masks so I can take mine off for a minute. It is a different time, and it's interesting times, but I'll agree with President Underwood. This is an exciting time. It's an exciting time for South Georgia Medical Center, Valdosta, Lowndes County, South Georgia, and the region we serve. Residency training has an impact that is far-reaching in a community like ours. It has an economic impact, direct economic impact. It has an impact, direct impact on the pipeline of physicians that are available to communities like ours, growing communities with growing needs. This residency training program will help us replenish and expand key clinical services over many, many years to come. And it's defining in that way, but it's defining in another way. You see, being a teaching institution requires a commitment to change and invite academics into the clinical setting. And when academics come in, a learning environment is effective. And through learning, we explore and understand better treatment capabilities that transfer to the bedside. And if there's one thing I'm excited about, is about all of that activity that will go on at the bedside that will serve our patients very well. It will advance our capabilities beyond where we are today. And if you can imagine what that means, with all of the residents, all of the physicians, these are physicians that are coming in for additional training, that will come alongside of all of the well-trained physicians we have. It can only enhance the care process. So with that being said, I just want to really thank President Underwood, Dr. Sumner, your entire staff that has been working with us on this in a collaborative, collegial way to realize something I think very special for this area. I also want to thank our medical staff, our medical executive committee. The medical executive committee is the elected leadership of the medical staff of over 400 physicians that serve here in some capacity or another. And the advisory committee of physicians that came alongside our board and decided we want to do this well. And to do it well is to have a partner with Mercer University. They decided, we decided, and here we are today in this very exciting venture. I also want to acknowledge the board of trustees for this hospital. They get recognized in the past. They don't get recognized for all they do all the time. But our board serves here voluntarily. I mean, you think about it. They come here, it's a large organization. They come here to do one thing and one thing only, and that's lead and serve. When presented this opportunity to affiliate with Mercer University and to commit $4 million in capital investment the first year alone, it was a non-issue. They said, let's do it. And we did it. And we're doing it. And it's a testament to who they are and what services they provide to this community. It's really interesting to me, President Underwood, that this coming Thursday will be the 65th anniversary of this hospital's existence, July 1st. 1 week from today, we'll celebrate 65 years of service. And, you know, it's hard to imagine what that really means if you don't dwell on it for just a minute. Now, let me hit you with that. You see, somebody back before the doors opened in 1955 decided we're going to have a prime hospital. We want a modern 100-bed hospital to serve our community. A key decision was made, a defining decision was made. You think about what's happened over the 65 years. The miles that have been walked, the people that have been served, the lights that never went on. There's always been here somebody with an open door that says to everybody in the community, regardless of who you are, where you come from, we're here to care for you. 65 years old. And it's very interesting to me that today there's another defining decision that is being made that will carry us for the next 65 years. Deciding to be a teaching 2,000 patients encounters every year with a wide range of specialties, and being the region's tertiary center, I don't think they imagine, and I'm not sure they imagine because of the teaching positions in their specialty. But it is an exciting day. I want to thank all of you for being here and all of our employees. We have 2,700 dedicated employees that want these hospitals, and they exist for one reason only, to take care of people and do it remarkably well. Our medical staff, for all you do, as our clinical chiefs, you drive what happens at the bedside, and we thank each and every one of you, and our volunteers, and especially our board that serves voluntarily. And as I finish, I want to ask my boss, really, chairman of our board, if he would come and share a few words. He has served as the chairman of the board for many, many years, Mr. Sam Allen, and he does this with great pride and selflessly in such a way, and I'm very proud that I'm a part of his team. Mr. Allen, would you come and share a few words?
Well, good morning. This is an exciting time for Valdosta, Lowndes County. As I stand here and I reminisce, I can remember about 10 years ago when our cardiovascular surgeons, Dr. Brown and Dr. Johnson, introduced us to Dr. Sullivan. And over those 10 years, we've been round and round this circle. We've looked at different opportunities. And it's ironic that we came back where we started. And it's because of the blessings that we've had in this community that we've done that. And also, we've probably got 3 or 4 CEOs doing that time also. And we're blessed now to have a great leader in Mr. Dean. We're certainly proud to have him with us. But we also are proud of our medical staff and all of our employees of South Georgia Medical Center. Because if not for them, we would not be here today. We worried about whether or not we had capacity to entertain such a program. We studied it, we put the money forward. My fellow trustees, they stood behind us, and we are dedicated and committed to this endeavor. We appreciate the collaboration. We look forward to all the great things, and the economic impact to this community is just going to be enormous. Thank you, Mr. Dean, for this time. Thank you, Dr. Underwood and Dr. Sutherland for coming. Many of you may not know Dr. Sutherland is a pediatrician in Wrightville, Georgia, and she's Herschel Johnson's pediatrician. So thank you for coming.